Panama today is administering the booster shot to people who received their second dose at least 6 months ago. Japan is to administer a third dose of COVID vaccine to people by December. Meanwhile, according to the Lagos State Commissioner for Health, it is possible that over time, the original vaccine is not going to be effective against the mutating virus. So it's saying that we'll need to develop an updated and upgraded vaccine to protect everyone from the evolving and mutating strains of the virus. Well, joining us to talk more about the booster doses is Dr. Akiala Ishaku. He's a virologist, and he joins us from Abuja studios. Glad you could join us on the program.
Thank you, Melissa, for having me.
Now, just yesterday, the Lagos State Commissioner for Health hinted at the possibility of booster jabs, another level of protection against the pandemic. But is this the time to be talking about this third dose or more doses when we don't even have enough to go around?
Melissa said it's not about talking whether we should have the next booster dose or not. The issue is that we don't have data. We don't have national data to support whether we need a booster dose or not. And so this brings to the national question, do we actually have a national data that will support the third booster dose? The issue is that this is a 21st century that it is knowledge-driven, and data science is quite key when it comes to inform policy and decision-making. So as a country, we have not done a zero survey to actually establish what is the level of our immune response to the COVID-19 vaccine in terms of the first dose, in terms of the second dose. And so we don't have a national data to actually, pin down that. So I strongly believe that until we have a national data, this will go a long way to actually give us an informed position on whether we should drive a policy for a third dose or not. But I think even we are being compelled by vaccine hesitancy, what we need to do more is that we need to do a lot of advocacy so that people will do the buy-in into taking their jab, and so that we can be able to cover the WHO target of 70 to 80%. But I think as at now, discussing third dose may be immaterial. We need to actually see to how we can drive the vaccination process.
So a national data on the one hand, but how about on the premise that this is a virus that will keep evolving, keep mutating, therefore we need to upgrade the vaccination strategy needed for protection?
Yeah, absolutely. So I agree with him on that, because in the field of vaccinology, once you have a viral particle that mutates over time and also has different variants, it is expected that you come up with an improved version of a vaccine that is polyvalent in nature, that can be able to address different variants. So in the coming days to come, we shall be seeing an optimized, improved versions of COVID-19 vaccine that will be able to take care of the Alpha and the Delta variants, and even more new mutating variants that we're expecting in the future. But what it is quite key is that what is the level of our vaccination coverage? So the more we have a target of 70 to 80% vaccination coverage, the more chances of reducing chances of mutating variants that may emerge, and also will also reduce the number of hospitalization and the severity of the disease. So what we need to push forward as a country, as a nation, is on how to have a targeted 70% to 80% vaccine coverage.
But essentially with that, we need funding, and that is funding to acquire more vaccines.
Yeah, absolutely. We need funding to acquire more vaccine. I have been on this channel severally to provide solutions. Time has come for multinational companies that are in Nigeria to actually see to how they can be able to push for acquiring. So we have a lot of multinational companies. In fact, what stops us, Melissa, for a lot of our political elite, a lot of our political class to soar or to donate part of their take-home salaries for the procurement of these vaccines. We have a lot of well-being individuals, guys that are doing great, the likes of Aliko Dangote, the likes of great guys that are doing well in this country. We have a lot of multinational oil companies, a lot of multinational companies. So it is time for them to come together and to see to how they can be able to fund this. I am quite glad that Marlon Sanusi, Lamido Sanusi was in Lagos, and they are seeing to how they can be able to raise a 10 billion naira endowment fund for medical research in Nigeria. And I'm also quite happy that NMA is talking about raising a health infrastructural bank. Those are the thinking in the 21st century, and that is the direction we need to go. So in the coming days to come, we also need to see how we can be able to be manufacturing these vaccines in-house. It is quite key. It is long overdue. So I am expecting us to have a presidential vaccine initiative task force. We need to also see to how we can also raise vaccine ambassador. Merlin said you are a potential vaccine ambassador for the push you have done for COVID-19 and the likes of many of your type that have pushed during this COVID vaccine. So we need to see how we can be able to reward you and begin to see how we can be able to come up with vaccine ambassador, people that can be able to become advocates for vaccine, not only for COVID vaccine, but for all childhood preventable vaccines. So this is the direction we need to go, and I think these are my prescriptions.
We'd like to thank you, Dr. Akiala Ishako, virologist. Always a pleasure having you join us on the program, especially on a pandemic that we understand will still be with us for quite some time. Thanks a lot.
Thank you for having me.